9:17, a health alert here for you now. Rates of colon and rectal cancers in people under the age of 50 have seen a sharp increase in recent years. Studies show people born around 1990 now have twice the risk of colon cancer and 4 times the risk of rectal cancer than those born around 1950. Now, a recent study shows sugary drinks may actually play a role in rising colon cancer in young adults. Dr. Jamin Brahmbhatt with Orlando Health joins us now live with more on this. Good morning to you. It is good to see you this morning.
Good morning, Danielle.
The first thing I thought about was, of course, Chadwick Boseman, right? And you think about how young he was when he was dealing with those issues that he was dealing with. And I don't think a lot of people thought about this being something as a cause for concern when you're in your 20s or 30s or even your 40s, right? What did your study find? What did this study find?
You know, Danielle, I actually take colon cancer very personally as well. I lost a very good friend of mine at the age of 38.
Oh.
So this is definitely something that's near and dear to my heart. I think the greatest thing about this study, it gives us information on certain factors that could put us at increased risk. Now, this study, you shouldn't get scared if you're having a fruity beverage right now. Now, you should think twice about it, but it looked at 95,000 women. And out of those, they found that about 109 were diagnosed with colon cancer. So that's a very small percentage. But when you take a deep dive into those numbers, those women that were drinking more than one sugary beverage, so pretty much something with fructose that's added into it, did have a higher risk of colon and rectal cancers. When you extrapolate this to all the other data that we're seeing out there, we are seeing this cancer earlier and earlier and earlier on in individuals. And that's why if you look at the screening guidelines, we're asking people to start getting screened at the age of 45 when it used to be the age of 50.
I know, and that's what's so scary, because now that number is even earlier than it was before. But I think a lot of people may not really know, right? What are some of the signs and symptoms that I should be looking out for, especially if I'm under that maybe age 45 mark?
Well, some of the signs and symptoms could be you may have some abdominal discomfort, some pain in the belly. You may have some blood in your stool. But a lot of what we do in screening is before you even get into those symptoms, let's find these things when they're very small, and they can be you can potentially be cured when they're caught early with something that's minimally invasive. So yes, if you have symptoms, definitely go and get yourself checked out with your primary care physician or a specialist in this area. But the reality should be is really focusing on that screening aspect.
Does this differ between men and women?
I think when it comes to overall colon cancer, it's the #3 cancer here in America. Over 150,000 individuals will be diagnosed with it. I think the recommendations are pretty much the same. If you're a guy drinking a sugary beverage, yes, the study was only done on women, but I think we can extrapolate that to men as well. I think the biggest problem here is not just the sugary beverages, it's the other risk factors for colorectal cancer and all cancers. That's increasing rates of obesity, being overweight, increasing rates of diabetes, and other metabolic disorders within your body that can be easily prevented with kind of taking a much more preventative approach with your health.
All right, the big takeaway, 45 now, the new age to get screened. Dr. Brahmbhatt, thank you so much for joining us.
Thank you, Danielle.